Hi, my name is Kelly, and I'll be the nurse prepping you for the surgery today. Hopefully, after today, the basal cell carcinoma will be completely removed from your teeth, so that's great news. I wanted to tell you a little bit about the surgery that was going to take place today. Basically, today we're doing the Mohs surgery, and the surgeon performing it will be a dermatologist named Dr. Jennifer Perrone. She's really well known in the dermatology world, and she has a bunch of experience with Mohs surgery, so you're in very good hands. She did a fellowship at UT Southwestern Medical Center, which is a really great institution. So she knows exactly what she's doing. Basically, today she's going to move the initial tumor with a curette, which is just kind of a little scoop-looking instrument. You'll be under local anesthesia, so you won't feel anything, which is safer than general anesthesia. So that's a really nice aspect of this surgery. After she takes off the visible tumor, she'll start she breaks the area into quadrants, and she'll start testing the area around the tumor just to make sure everything is totally clear. There's no cancer cells. Her way of doing this makes it where there's a lesser chance for scarring because she doesn't have to take as much out of the skin, and she makes sure she really gets everything because basal cell carcinoma is really well known for really rooting into the skin because it's in the deepest layer of epidermis. And you want to make sure you really get everything just so there's a smaller chance that it won't come back. So here she's basically going to try and remove as much, well not as much, all the cancer from the tumor, from the site, without damaging as much healthy tissue as she can. This is a really effective treatment in basal cell carcinoma because it really gets down deep and gets rid of everything. Fortunately, basal cell carcinoma is really localized, so it doesn't really spread and have really wide margins, so that makes it a bit easier to use. But this is a really good procedure for that. And it's really good that you notice that the little small sores were not normal, so you came in to get them checked out. Another reason that this surgery is a really good choice for getting rid of basal cell carcinoma is because she's so good about getting the tissue, the tissue that's infected and not healthy tissue, is hopefully you'll have normal function in that area of your face. And the scar will be as small as possible because you won't have to keep going back and taking more and more out like you would with some other surgeries where they have to, take a sample and then go do a biopsy and do some tests on it and then decide if they need to take more or not. This way it's, real cut and dry. They go in, they take out what they need to, and they're done. Because they have to, go through and test the margins and make sure there's no cancer in the area that they've left, this procedure could take a little longer, and there's really not a good way to tell how long it'll take, but just know that, she's being really meticulous in going in and testing everything she needs to, so she'll get everything she needs to. One unfortunate side effect of this surgery will be scarring on your face. Typically, this surgery, like I said, minimizes the amount of scarring there is because they don't take as much healthy tissue as with some other procedures, but there is a little bit of a risk for that. They typically use stitches to close up the wound, so there's definitely, you have to follow up with the doctor to get those removed, and it's really important that while the stitches are in, you take care of them. Basically, the first 24 hours, you probably will just leave the bandage on and not really mess with it. But after the first 24 hours, you'll be able to take the bandage off, and it's really important that you keep the wound clean just to prevent infection. And to do so, you should take, warm water, not really hot, and not apply the water directly at your face, maybe run it down your face. And don't scrub the area because you don't want to break open anything because that defeats the purpose. So basically, you're just gonna, really gently wash the area and pat it dry. Don't, rub it or scrub it. And then after you do that, the doctor may give you some ointment you can put on over it just to keep it nice and moist to prevent as much scarring as possible. And then if you really care for the wound properly, that'll lessen the chance of any scarring. So hopefully when you come back in, they can, take out the stitches. And if you just keep up with it, hopefully there'll be as little damage as possible and it won't be as noticeable. So I hope I answered your questions, and if you have any more, the doctor can answer them, or once you get out, the post-op nurse will be able to, clarify anything you need to.